RPA has launched the next phase of testing and evaluation of our Advanced Chronic Kidney Disease Patient Management Toolkit. To demonstrate the widespread usability and value of the toolkit in improving patient outcomes, RPA, in conjunction with the Duke University Center for Clinical Health Policy Research, is conducting a comprehensive field test of the CKD toolkit in 10 randomly selected nephrology practices around the country. As you may recall, RPA developed the toolkit in 2004 through a rigorous scientific process to help nephrology practitioners implement the recommendations included in the association's evidence-based clinical practice guidelines on appropriate patient preparation for renal replacement therapy. The toolkit is organized into 4 main areas: assess, tailor, implement, and evaluate. It includes 16 sets of tools for healthcare providers and kidney patients. The first iteration of the toolkit was pilot tested in 2005 in 2 nephrology practices in North Carolina over a 6-month period. Published results from that test demonstrated the value of the toolkit in improving patient outcomes in the areas addressed by the guidelines. Modifications were made to improve the toolkit contents, which are included in the current iteration being tested more broadly. The current 10-site toolkit field test will evaluate usability of the toolkit in practices of varying sizes and patient populations and the impact of tools on improved conformance to the clinical practice guidelines. Additionally, it will assess care patterns and practices and the process changes required to improve patient care. During the test, RPA will also study whether a practice utilizes an electronic medical record plays a role in toolkit implementation. A certified professional coder with nephrology expertise will collect data from 30 de-identified patient charts at each practice sites at various intervals. Duke researchers will analyze the data before and after toolkit implementation to determine a baseline measurement and subsequent changes in processes and outcomes. All tools in the toolkit will be implemented by each of the 10 sites, including awareness, assessment, and management tools, and patient diaries. The sites will customize tools as needed for their individual practices with guidance from the RPA Duke team. The durability of use and value of the tools will be assessed 6 months after completion of the implementation exercise. After completion of the study, a comprehensive analysis of the results will be prepared for publication in a peer-reviewed journal. News about the study will be announced in future issues of RPA News and at RPA's annual meetings in 2009 and 2010. By measuring the impact of the Advanced CKD Patient Management Toolkit in real-world clinical settings, RPA will gain valuable knowledge about processes nephrology practices require to successfully utilize the toolkit with the ultimate goal of improving patient outcomes. As the population of chronic kidney disease patients continues to increase, RPA will provide you with effective tools to help you care for kidney patients. To obtain a copy of the toolkit, contact the RPA office, or you may download an electronic copy from the RPA website.